So all the past 10 years of APPG papers we have discussed, debated, delivered and available on YouTube. You can go to youtube.com/onlineMBBS. So you will go to our channel. So there you type APPG, you have all APPG papers, discussion, complete discussion. And we also have Karnataka State MD entrance papers, past 10 years available on the channel. And also we have COMEDK paper discussion also every year available free on youtube.com/onlineMBBS. So you can review that whenever you feel bored. The idea is you should keep moving. Let the party keep moving. That's what a DJ will do. So ultimately, doctor, you keep the party moving when you are preparing. Don't stagnate. Don't say tomorrow I will read. Tomorrow doesn't come, doctors. Every day Steve Jobs, the founder of Apple, used to stand before a mirror. He used to think, today if it is last day, if I am declared by evening that you are no more tomorrow, what I am going to do? That gave him courage to accept a lot of decisions in life, right? So you should also think that way. At least the next 2 months you must be maniac, academically maniac. You must be on the other end of the bipolar state. So ideally, whenever your energy is coming down, remember there are only 2 reasons. Either you are surrounded by pessimistic snobs, get rid of them, who fear about life, don't get surrounded by them. That's one possibility. Or number 2, you are reading unnecessary material just to show off to other and defeating your brain. If you are not doing either of the 2, you are surrounded by enthusiastic companions in the reading room or anywhere you read, and you are reading high yield topics, one after the other, you are finishing, and you are not aiming to read all 100% 1190 topics. What you didn't read in the past 10 months, where will you read in the next 2 months? At least you read 50% of high yield topics, ek bar. Your energy must be high. When it is going down means check these etiological factors. Sometimes solve MCQs, sometimes review those topics which you need to push up a theory point of view. Ultimately 8 weeks will pass like 8 minutes, let me tell you. Now let's take up the next question, doctor. What is wrong about colchicine in gout?
C. It is not a pathognomic.
It is?
Not a pathognomic.
It is not a... no. What is the answer?
C, sir.
Even in pseudo gout also you get a relief if you give colchicine. So it is nothing to do with the diagnosis. Now should be an answer, doctor. A patient with rhesus negative blood by mistake was transfused with rhesus positive blood. What is the first stage of the blood reaction? You are going to give me an answer. Will donors erythrocytes adhere or recipient erythrocytes adhere, or anti-rhesus agglutinins form, or platelets aggregate, or donor erythrocytes hemolyze? दिल का आंसर बोलो. Around 40% of questions will be requiring your imaginative skills and guessing in exam. It is not what you exactly read there you will come here, like map pointing in social studies. C, it won't be like that. What is your answer?
C. C.
C you want to say. Nafis, what is your answer?
First stage.
Ram Krishna is proposing E.
Donor erythrocyte adhesion. A.
You want to say A?
Either A or C.
No, we want only one.
A.
A. A is the answer. Sharad? Sharad proposes C. Let us check. Akshara is thinking anti-RH agglutinins.
C.
Rupa and Akshara are both thinking C.
C.
Who said A? Please give a big clap. Loud clap, loud clap. That's good. Nafis always makes us proud. So what is topic number 14? High yield in pathology. Blood grooves, without that there is no paper.
Even if we read that, we can't answer such questions, sir.
No, no, if you read, it's a good point. Huh? If you read, at least you will not wildly guess. That's the only idea. There must be some reason that directs you towards the right answer, no? What is that reason? It is not the spiritual power.
It depends on exam.
At least
to
you
exam,
read.
sir.
Huh?
If it depends on exam to exam. If it's like AIMS exam, the answer will be what we can't, it will be a wild answer. So we have to go for something which we can't even imagine. Put that answer. If it is.
After you get seat, join our faculty. So that you can tell all your concepts to students. Right or wrong doesn't matter. Who believes, believes. So that's important. Now, Lofgren's, what is accept about it, doctor? Huh? One confident answer?
D.
Polyarthritis is not a feature.
Sir, prognosis?
Fever, bilateral hilar lymphadenopathy, polyarthralgias. Polyarthralgias. Arthralgias are pain. Arthritis is inflammation. There is a difference. Huh? What is wrong about vagina? Should an answer, doctor. One question on vascularitis.
A.
You like to say A?
C, sir.
C and K will
C,
be
sir.
there.
C, sir. C,
C
C.
and K will be there. No?
Ramakrishna says C. A is Nafi's answer. On renal biopsy, do you see any deposition in basement membrane?
No, no.
That is very important feature.
Specific.
That's a very important feature that no immunoglobulin or complex deposition with crescentic necrotizing glomerulonephritis is the feature of vaginal granulomatosis is what you need to basically remember.
Sir, is it P and K or C and K, sir? In the question it is P and K, no, sir?
What is given in?
PR3 means?
PR3 Anka, okay.
P, uncle.
What was the finding of in the setting of pulmonary nodules were sufficient for the diagnosis?
Sir, is it P or C, sir?
Between what is PR3 Anka means?
C, uncle, sir.
C Anka or P
PR3
Anka?
means C, uncle. C, C.
Generally, the presence of pulmonary nodules with you go through the entirety of the statement. If you find all the three, there is no other diagnosis that should be considered. That should be vagina. That should be vagina. That's the meaning of it. What is the closest to differential diagnosis for the vagina?
Microscopic polyangiitis.
अब बहुत दूर गए. मेरे मतलब है एक पेशेंट हिमोप्टिसिस और एक कैविटेटिंग लंग लीजन के साथ आएगा आपको.
Sarcoidosis.
Sarcoidosis.
Oh, sarcoidosis, if you say in MD exam they will fail.
TB.
Tuberculosis, doctor. There are a good number of cases of vagina treated with anti-tubercular therapy who come to you to a tertiary hospital. Then you will be taking a history. Why this guy is having hemoptysis, cavitating lung lesion, also hematuria? Then what will your colleague will say? It is all TB only. TB in the lung, TB in the kidney, TB everywhere. Because TB is his first diagnosis, second and also third diagnosis, which is good. Ideally you should think like TB only. Sometimes what is not TB, don't think like TB. What else will patient will sometimes say? Recurrent sinusitis, sir. He will take out a big list of CT scans. East Coast Hospital, Konesima Hospital. Sir, my ENT surgeon, even with the slightest nasal infection, he will advise everybody to get a DNA scan done. So you will have a bunch of CT scans, MRIs, CT scans, thinking he has some nasal problem. So what is Vaginal's highlight, doctor? Upper respiratory, lower respiratory and also renal involvement. All the three can only be explained by?
Vaginous.
By the vaginous. Yes, watch it, remember. Now, what is wrong about systemic sclerosis?
B.
B, sir. B.
D or B?
B.
B, that's right. It is a diffuse disease, not the limited disease, where you find the topoisomerase 1. Now doctor, what is the mainstay of treatment of Kawasaki?
A.
Immunoglobulins, A.
Intravenous gamma globulin. Easy question to guess. What is wrong about polymyositis?
Eyes are involved.
Eye muscles are involved.
B.
Eye muscles are involved or not involved?
Not involved.
That's very important. Now one quiz question. What is the most
Factor
common?
5 Leiden.
Huh?
Factor 5 Leiden.
Factor
5
5.
acquired.
If you said
Sorry,
hemophilia A, I would have been little better in the graveyard.
The most
Von Willebrand. Von Willebrand. Von Willebrand.
Hemophilia A nahi hai kya?
EMF.
Nobody want to say hemophilia A. Oh. Von Willebrand. Von Willebrand. If this question comes in exam, you by mistake answered hemophilia A. You have to put the foot in the mouth. That kind of a question this is. Okay, doctor? 10,000 people will walk on your cadaver. Your rank will suddenly go behind. You will be given 2 to 3 lifeline chances, like in Kaun Banega, PG Pati. Those 2-3 this kind of silly mistakes you do, maximum 2-3 is permissible. Beyond that means you are ready for the next entrance. Get ready. Huh? Ask the university, will they give any discount? 2-3 years के लिए एक ही बार apply करे तो Axis Bank में. हाँ? तो coagulation cascade is the next high yield topic in pathology which you need to be sure. Right, doctor? Which is not present in
C. Symmetric.
Symmetric 6 months.
symmetric will take little
6
longer
months.
time, unlike asymmetric is what you need to remember. Now, doctor, what is not a good prognostic feature in ALL?
C. C.
C, sir.
Pre-B-cell ALL is associated with poor prognosis, but hyperdiploidy, female sex, T1221, good prognosis. Pediatrics means leukemia, very high yield topic. Anybody is having the high yield topic booklet? You check leukemia is given as which topic? 5th or 6th or 10th at most. High yield topic list. Pediatrics open करते ही textbook क्या पढ़ना डॉक्टर? Developmental milestones. बच्चा कब उठेगा, कब रोएगा, कब crawलेगा. All those things you should finish. Then go for a cup of tea, because you learnt developmental milestones. Then you finish another couple of topics. What is the second high yield topic in pediatrics given to you? Huh? Pediatric hypothyroidism. Don't forget the importance of it. If you take past 15 years all India MCQs, almost every exam may one question on pediatric hypothyroidism. Generally after developmental milestones we will go to the protein energy malnutrition in the pediatrics textbook, because nutrition chapter is after growth and development. No, you should straight go to pediatric hypothyroidism. That should be your redirection of the Google navigation in the textbook. Top 30 topics you read, throw away the textbook. That's all what you need to do. Okay, doc? Now, let's take up the next question. SSP
Measles.
Measles.
in the case of the measles. Now, doctor, a child comes to
Calcium
casual
gluconate.
C,
tetany,
sir.
Calcium gluconate.
Calcium gluconate.
inject calcium gluconate. Most common solid tumor.
Neuroblastoma.
Wims.
Anybody answered it as Wilms tumor? What is your answer?
Neuroblastoma.
Ah, good. That's good. Neuroblastoma. Wilms tumor commonly presents as
Mass.
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 abdominal mass. In the high yield topic list, where is Wilms and neuroblastoma? Are they there? In pediatrics, they will be there. Some 15th topic or 16th topic in the priority list. Without visiting neuroblastoma, Wilms tumor and brain tumors in pediatrics, preparation is not over. Now, doctor, Down syndrome, what is except?
Hypertonicity.
Hypertonicity.
Hypertonicity is what we
Hypertonicity.
typically come across.
Rota.
Diarrhea,
Rota.
rotavirus. That's good, doctor. Second phase of bronchial asthma, how can you
Steroids.
prevent?
Steroids.
By giving the steroids. That's good. If you sing along the answer, I am a happy guy. Mycoplasma,
Erythromycin. Macrolides.
erythromycin. Without looking at the key, you sing along your answer. We will identify wrong answer and talk about it. Now give an answer. Extempore. Arthus reaction, what is except about it?
A.
It is not systemic reaction. It is a local reaction. That makes it the Arthus. So what is the next high yield topic number 16?
Hypersensitivity.
Hypersensitivity in pathology. Nowadays type 5 or type 6 hypersensitivity also have come. So you must be sure on, you only know 4, no. 5 also you may be knowing. Yeah, 6 is not there. I am scaring you.
What is 5, sir?
Now,
what is 5, sir?
That's what I am asking you to read. If I tell even that also, I will be immunosuppressing effect will be there on you. The job of a teacher is not to tell everything. Yeah. Single hyperpigmented anesthetic patch with satellite. Tuberculoid leprosy. Really? Now, doctor, Ridley-Joplin classification, everything you must become encyclopedic in reviewing that topic, doctor. Oh, really, we don't have time for all these images. Okay. Metastasizing the lymph nodes? Basal. That's right.
Salicylic acid.
Salicylate is a keratolytic. Mohasov wali cream. Clear cell. But acne is more common in boys or girls?
Girls, sir. Girls.
Boys.
Androgenic effect of the boys, testosterone, doctor. But in the advertisement they show the girl in a clear cell. That's right. Now, lepra-1 reaction.
Steroids.
Corticosteroid. Lepra-1, lepra-2. You must be quite sure differences between the two. Which type of hypersensitivity it is. Everything you should read. Now, doctor.
1, 4, 2.
Yeah, there is a lot of literature I leave to you. If you still have energy, you can review. Yeah. Peripheral scaling, central scarring.
Lupus vulgaris.
Biopsy.
There is no secondary thought for this, that would be biopsy. And what is your thought process about it? TB. Lupus vulgaris is what you need to basically expect. So in tinea corporis, what do you see, doctor? Central clearing, vulgaris, central scarring, leishmaniasis, central crusting. Everything central. Now, yeah. And one more lot of literature. Let's leave all that. So we have already online dermatology complete review of the top 30 high yield topics is available in the online video library. Small subjects you can always review online. Now, doctor, best anesthesia for status. Ketamine. That's right. Ketamine. Propofol and 5-pentone.
Inducing agent.
Are basically induction agents. I think idiotic question. This is interesting.
B.
I am listening. What else? B you want to say. What else? Ramakrishna says B.
B.
Alternative answer? That's right. Preganglionic, sympathetic, then pain fibers, then sensory, then motor is the order of anesthesia in decreasing order. Don't forget this list. It all depends upon how many sodium channels are there, thickness, so many factors.
C.
Heart disease.
C.
Recent MI is a contraindication for the elective surgery.
1 month.
So you must know all absolute contraindications for general anesthesia, doctor, thoroughly. Selective bronchial intubation. Endobronchial tube. Now shoot an answer. AML with worst prognosis is which one?
Monosomy 7.
Beautiful. Monosomy 7. So what is the next high yield topic number 17 which you will not forget in pathology? AML and ALL. Lymphoma was in our analysis second high yield topic, second or third. Generally while reading we will try to give equal importance for leukemia, lymphoma, everything, but if you look at percentage, number of times it happened in the AIMS or India PGA in the past 15 years, leukemia is also asked. You have to review because it is in the top 20 topics. That's very important. Now which is not caused by phenothiazine? Huh?
Diarrhea.
That's good. So you must know constipation is whose side effect, etc., etc. Now doctor, yeah, beta blockers, where are they effective?
Anxiety.
That's wonderful. Then hyper awareness of one's own bodily functions is what?
Somatoform.
Huh?
Somatoform.
Hypochondriasis.
Hypochondriasis or somatoform?
Hypochondriasis.
Clear definition you must know the difference between the two.
Sir,
Huh?
hypochondriasis means patient will already think that she has particular disease.
There are 2 to 3 differences. One is who will exaggerate the existent finding, who has an insight, who will do for some amount of attention seeking and incentive. There are differences between all these. We reviewed it in psychiatry. Just review all that, doctor. Now, which is NASA? What is the topic we are weakest in pharmacology in MBBS, doctor? Antipsychotic drugs. Why we are weakest? You sincerely thought of reading it in pharmacology. Suddenly your senior came and tell in the reading room, psychiatric drugs पढ़ रहे क्या? Somebody has committed suicide after reading this topic. They won't ask in MBBS exams. Don't read, is what he told. Oh, anybody who reads psychiatric drugs is bound to die, is what you believe that during that time. Because we believe in first year, second year, whatever the seniors say. So tell me, doctor. One question on at least you know classification of antipsychotics. Must too much of learning. Bolo. Mirtazapine is what you need to remember. Tell me, doctor, imipramine, clemipramine are all tricyclic antidepressants. SSRIs are fluoxetine, paroxetine, fluoxamine. Then you are having serotonin, norepinephrine, SNRIs, venlafaxine and duloxetine. Then you are having norepinephrine, serotonin reuptake inhibitors. Then you have NASAs, which is mirtazapine. Then you are having norepinephrine, dopamine reuptake inhibitor, NDRIs. Bupropion is an example. And you have serotonin antagonists and reuptake inhibitors, SARIs, which is trazodone and nefazodone. And you have noradrenergic reuptake inhibitors, NARIs, which are basically reboxetine. Too much. Pehla, are able to swallow or not, first you see. During the last 8 weeks, if you can swallow, you check any chance of aspiration pneumonia. If I read all this, still there is no risk, then you read it. Okay. So some of your friends will be asking questions in the reading room. No, first criteria is what? Rule of Lok Sabha. If it belongs to high yield topic list only, you answer, or you listen also. If it is high yield topic list, once more in the high yield topic list also, you have useless questions that can be framed. That also you must know. High yield facts within high yield topics. That's important. Carbamazepine, where will you use, doctor, for prophylaxis?
Psychosis.
Maniac psychosis. Adder head.
Ureterocele.
Nafis, what is meant by adder?
Cobra.
Oh, beautiful. So it is ureterocele, not cobra, but yeah. This is the adder whose head is like this. Even ureterocele with a dilatation peripheral looks like that, making it addercele. Sentinel loop is which part?
Jejunum. Actually,
Beautiful.
colon.
Sentinel loop is that localized ileus involving the jejunum whenever pancreatic inflammation is there. You also see colon cutoff sign. Suddenly the gas in the colon will stop at one point, which is another important feature which you need to remember. Now another thing, carcinoma of pancreas may all radiological features. C loop widening, duodenal indentation, double duct sign, scrambled egg appearance, reverse 3 sign, classical, etc. etc. Now, radiolucent is urate stone, easy to remember. Crumbled egg is which one?
Hydrated cyst.
Hydrated cyst with all that wall calcification. Then ischemic colitis. Thumbprint elections are ahead of us. Now give an answer. What is the wrong statement about lung cancer, doctor? Harika is reporting a lag over of the video. Please check. Is the voice and video lagging?
C.
C, sir.
C.
Huh?
C, radiotherapy. C.
You like to say?
Radiotherapy.
C.
You mean to say it is not best treated by surgery? You mean to say that or any other answer? C only, no?
C.
Small fellows run faster. Small cell cancer metastasizes by the time you detect it. Where will you cut? Entire body you have to cut. So that is the reason उतना कुर्बानी के लिए तैयार नहीं है. So इसलिए small cell cancer में you will not. So what is topic number 18 in high yield list? Pathology of lung cancer. Definitely one question is going to come. This is a beautiful question.
1800. 1800. Calculation we did, sir.
1840.
1800.
We expected you to calculate only. Sudden auditory hallucination you won't know. Yeah. 1800 is your pakka kya? How did you come to 1800? Wo batao.
Sir, 70 kg man, like 5 gram per kg carbohydrate. That comes to 350 grams carbohydrate. 350 into 4. That's like 1 gram 4
बढ़िया. Nitrogen के बारे में क्या किया आपने? There you went wrong.
4, sir.
It is not protein given. It is nitrogen given. So you need to convert nitrogen into protein first. So what is the way you calculate 0.2 gram per kg per day of nitrogen is equal to 1.25 gram per kg per day of protein. Kirana set, Kirana merchant ke jaise you should answer this. How to calculate the nutrition in intensive care unit. So 1.25 grams protein into 4 kilocalories you need to add into 70 kgs, make it 2128 is what you need to remember. Okay. Keloid versus hypertrophic scar.
D.
Growth beyond the incision site is a differentiator. Particularly was scrotal pain.
Epididymis.
You didn't think of testicular torsion?
No systemic features, no fever.
Good. That's how you differentiate fever is there or not. Is a way to. Lowest ulcer recurrence?
C. Antrectomy.
Vagotomy and antrectomy. Both electrical connection and also secreting part. Gastrocolic fistulas is not a feature of.
Pancreatitis.
All look to be responsible, but one is not.
Pancreatitis.
Huh?
Pancreatitis.
Pancreatitis. Pancreatitis. It is related to colon and one way related to the stomach bed. Don't you think it has a chance of bridging the two?
D.
Question number 115. Srinivas is proposing pancreatitis, Rupa says A and Bhalina says C. Ischemic colitis is not. Why will it link to the stomach? It is only colon related. All the remaining can definitely lead to gastrocolic fistula. Toxic megacolon, what is except?
C.
Huh?
C. C.
C.
Toxic megacolon. Is barium enema is diagnostic? Barium enema is contraindicated in fact. You will be finishing the job started by God if you give barium. So it will lead to perforation is what you need to remember. These are all the recognized associations except what? Simple logic. A. You mean celiac disease is not related to the esophagus? Anywhere in the GI tract celiac disease can involve, but more common in the duodenum, jejunum, in those areas.
D, sir.
Celiac can show effect anywhere.
D.
D.
Lymphoid hyperplasia does not lead to lymphoma. Now doctor, pre-aortic group of lymph nodes, what is except? You like to propose? Obturator is not. Celiac, superior mesenteric, inferior mesenteric जाएगा pre-aortic. Gastric, hepatic, pancreatico-splenic जाएगा celiac. And mesenteric, ileocholic and pararectal drain into superior and inferior mesenteric group of nodes is what you need to remember. A calicus cholecystitis. What is your?
Murphy's sign is positive.
Huh?
A.
Murphy is not positive. Is not positive in a calicus cholecystitis. Only ultrasound, when you check, you will discover some amount of sludge. That's how you identify. What is the cause of generalized gallbladder thickening?
D.
Huh?
D.
That's right.
D.
Hepatitis, ascites, CHF, anything can lead to.
Sir, what is benign ascites, sir?
Which is, what is?
Benign ascites.
Benign ascites. In the presence of ascites, a thickened gallbladder suggestive of benign disease. Okay. Cholangiocarcinoma, what is except about it?
D. D.
Huh?
D. Ascariasis.
That's right. Caroli, ADPKD, alpha-1 antitrypsin. All of them are very much associated. Very vascular pancreatic tumor is which one? Huh?
I wrote it B, sir.
Acinar cell. What is Ramakrishna?
Islets. D, sir.
Islet cell tumor. Islet cell tumor. Adeno is avascular. Microcystic is vascular but not macrocystic. Metastases are hypervascular. What is except about pancreatic adenocarcinoma? Huh? Lynch, Gardner, hereditary pancreatitis. All of them will predispose but not. Ulcerative colitis is what you need to remember. Yeah, but ulcerative colitis is the most common guess because it is within our reach. Huh? Now, directly related to the liver and separated by the peritoneal covering except D. That means which are there nearer to Bay Area. What is your answer?
D.
You like to say?
Distal IVC.
Esophagus is what I am listening.
Distal IVC.
Distal IVC.
Esophagus.
Good. Ramakrishna, you are not having the key with you, right? Very good. Good guesswork. See, doctor, right adrenal, upper pole of right kidney, distal part of IVC. Oh sir, Bay Area के बाजू में रहते. There are no peritoneal coverings. Is what you need to remember. I think this time surgery is very slippery. They look approachable, but we are slipping. Some slipping practice also we need to give, no. A normal adult has splenectomy. All these are the sequelae except
A.
If the spleen is not there, there is nobody to kill platelets. Platelet population will increase.
Say D. D is also correct because if spleen is not there, nobody to digest hemoglobin and release hemoglobin, so decreased iron transport.
There is nobody to digest hemoglobin. Who digests hemoglobin?
Macrophage of spleen.
In the spleen will digest hemoglobin.
Will release hemoglobin. Will digest hemoglobin and release the iron.
But first a spleen should be there to break the RBCs to release hemoglobin, no? Okay. There is no release of hemoglobin, no digestion of hemoglobin, you want to say. Very far-fetched imagination. So, except D, everything else is seen. Intra-aortic balloon pump, what's your answer?
C.
Huh?
C.
Yes, doctor? Some volunteer an answer. Helium rather than CO2 should be used for inflating the balloon. Carcinoma of esophagus, what do you want to say?
D. D. Plummer Vinson.
Karthik, D. Carcinoma of the esophagus, Plummer Vinson, iron deficiency, Webb, Esophageal cancer. वो सब पढ़े ना doctor. What is the other attraction for you? Wrong answer was what? You said something?
D only.
Okay. Then subtotal thyroidectomy doesn't include? Easy question. It is the hypo, not hypercalcemia. Post gastrectomy syndrome?
B. B.
Folate deficiency is uncommon. It is a late dumping which is because of rebound hypoglycemia. Anemia is seen definitely.
Sir, backache, why was there an option?
Where was that? Backaches
Backache.
are not causatively linked.
Why backache, sir?
Actually, I didn't observe that there was an option like that, but yeah. Metabolic bone disease and backache. Huh? Now, with regard to thoracic outlet syndrome, what is except?
B. It's lower trunk, not upper trunk.
Beautiful. It is a lower trunk which is important. Colovesical fistula, except, I think it's a repeat. Thank God, same answer. Otherwise, I need to once more start justifying something else. So, now, what is the most common cause of SVC obstruction?
D.
Bronchogenic carcinoma. Even lymphomas also. What are the 4 anteromediastinal tumors? 4 T's. Thymoma, teratoma, terrible lymphoma, retrosternal thyroid goiter. 4 T's and anteromediastinal tumors. Now, doctor, Burn scar tumor is?
Squamous cell carcinoma.
Squamous.
A.
Is basically squamous cell carcinoma. That's good. Testicular neoplasm, what is your answer?
D.
D, sir.
D.
D. Huh?
They are the commonest form of cancer in young men, not old men. They have prostate waiting for them.
It's not most common cancer in young men, no sir. It is lung cancer.
So testicular.
That's also right. I mean, in the testicular area, any mass lesion in a young individual turns out to be testicular cancer more commonly.
Mentioned, no sir, most common in testicular.
That's also true. That this question requires a better English. Mucus diarrhea with low serum potassium. It is
A.
villus adenoma, which will be hypersecreting potassium.
Yes.
Acute mesenteric vascular occlusion, what is wrong?
C.
B. Symptoms
occur
early.
Early in case of mesenteric vascular occlusion. Severe abdominal pain, etc. will be there. Then, but what about the clinical signs, doctor? Patient will be very symptomatic. As such, he is dying due to peritonitis. Severe abdominal pain, he will be bouncing. But when you examine, there is no guarding rigidity or any clinical signs will not be there. Symptoms will be more. That's a very typical feature. Then DVT prophylaxis, which agent is used?
A.
I mean, with regard to that.
A.
B. B.
I am listening. A versus
B.
B. Any other answer?
Yes, sir. A.
They have done studies which are not in your control, Ramakrishna. They found there is greater protection or lesser protection is no difference between 8 and 12 hour regimes.
Sir, can epidural technique be done with heparin?
Absolutely. That is also another study which is not in
Can
your
be done
control.
with warfarin, not heparin, no sir.
No. The idea is low dose heparin regimes may epidural karo. There is nothing that prevents you. Right? But if the patient is having a clotting disorder as such, then it stands as a contraindication. It's a little guideline based question.
B.
Option D only I am saying.
B.
B for boy. Low molecular weight heparin versus Unfractionated heparin. I leave to the literature. In that somewhere one statement is written about the guidelines. It's already there. It causes less bleeding, right? That is also there, I think. That option also stands equally good. Okay. Small bowel obstruction, 65-year-old who is vomiting. 5 liters fluid lost.
C.
Huh?
C. C.
D sir. D sir. Sir, D for doctor.
D for doctor? That's right.
Sir, but
You must know which fluids are isotonic. Which fluids which we lose from the body are hypertonic.
Sir, in vomiting condition.
And how will upper GI versus small bowel obstruction differ from large bowel obstruction? So all that is where you call it as a desalting water loss. Whenever there is a loss of the fluid associated with vomiting and bowel obstruction. So that leaves the answer for that.
sir,
Yeah, yeah, please.
I thought because the already 5 liters of fluid is lost,
Okay.
so maybe hyperaldosterone state will be created, so sodium absorption will be increased. Like that I thought.
Sodium absorption will be?
Increased.
That's what it is. Less likely. This is a good point. But where will hyperaldosteronism occur?
Kidneys.
More often if the hypertrophic pyruvate stenosis like conditions are there, no, where you are vomiting excessively. In those scenarios, hyperaldosteronism is more often quickly predisposed, unlike in the small bowel obstruction where the fluid loss is more isotonic in nature. That's the difference. Now doctor, a front seat passenger,
D.
all this will raise suspicion of ruptured aorta.
D sir.
Where will mid-esophagus will
To
twist
the right.
into? Right side. How will you know that it has twisted? Rail tube is there, no? In the imaging you will see how the rail tube got drifted. Now after partial gastrectomy, what is the commonest cause of anemia?
B.
12 months after.
B sir.
B.
B sir. Intrinsic.
B,
Intrinsic
B.
factor. Intrinsic factor.
Intrinsic factor.
Any most common will be iron only.
Lay sir. Intrinsic factor sir.
30% of patients within 5 years after partial gastrectomy is what we need to remember. All the other complications will not wait until 12 months. You take afferent loop syndrome or any other features, they will present much earlier, they won't wait.
उससे भी ज़्यादा common है.
Okay, now doctor, most common malignant bone tumor, let's run fast.
C. Meds.
C.
Metastasis, ortolani spur,
CDH.
CDH, bony ankylosis is
TB.
TB arthritis.
TB arthritis.
TB arthritis.
TB arthritis.
TB sir.
TB.
TB sir.
TB.
TB arthritis sir.
TB arthritis. Oh, correct.
TB produces fibrous ankylosis except in TB spine, where it produces bony ankylosis. Clear? That's good. Tumor from epiphysis is what? One question on bone tumors. If you take orthopedics list, no? Orthopedics, if you don't like orthopedics, you can't read orthopedics. You get spontaneous pathological fractures while reading. Only read top 20 topics. Only read top 20. 10 questions in exam may at least 8 questions will come from the top 20. What is the first topic?
Tumors.
By the time you read bone tumor only, you are half liquidated. So right? Bone tumors. So top 20, you go through that list in the descending order, not according to the pages in Maheshwari. Now,
Yeah.
yeah, Coxvara,
All.
All.
all of them. Osteosarcoma,
Paget's.
Paget's,
C.
very good.
C.
Chondroblastoma,
Epiphysis.
Epiphysis.
epiphysis, that's good. Septic arthritis,
All.
D. All.
All.
All, sir.
all of them. Most common dislocation,
Posterior.
Posterior. B.
shoulder mein,
Anterior.
that's very important. Now most common
Malunion.
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 malunion, not non-union,
Actual step.
herpes,
Dendritic ulcer.
dendritic ulcer, then Salmon patch,
Tuberous sclerosis.
huh?
Tuberous sclerosis.
Retinitis.
Salmon patch.
Ah.
Treponema will be crying if you say tuberous sclerosis. Oh, where salmon patch you want to say? I only. We are in ophthalmology, no? Interstitial keratitis, doctor. Syphilitic keratitis may you have syphilitic interstitial keratitis where salmon patch appearance will come. बीच में tuberous sclerosis क्यों आ गया? कुछ patch है क्या उसमें?
Shagreen patch.
Shagreen patch and salmon patch are as far as Anakapalli and Antarctica. You are trying to think both of them are similar. Very too far, doctor. Paralytic squint. But once more, if you do salmon patch wrong, foot to mouth syndrome. Assured. Be very sure.
Coxsackie.
Don't do such mistakes. You do some great mistakes, we will agree. We will agree. So, a feature of paralytic squint is what?
Yeah. Yes. Yeah.
Cover, uncover. Once more, strabismus, ophthalmology mein dirtiest topic. 30-minute video is there in the online video library at online MBBS in ophthalmology. Just review that, all things are taken care. Concomitant squint, divergent squint, convergent squint, primary deviation, secondary deviation, all dustbin things.
Sir,
Now,
paralytic squint, isn't it obvious, sir?
isn't it?
Isn't it obvious? Do we have to do a cover uncover test to actually know it?
I mean, I leave the literature, just you need to read. Once more, going through the specifics is very tough. Just review that, doctor. Anyway, non-paralytic squint. What are the quick 5 points? Congenital, diplopia is absent, extraocular muscles and nerves are normal, hence called non-paralytic. Angle between longitudinal axis remains constant whenever you are testing the eye movements, is another important feature. Both eyes will have full movement if tested separately because it is non-paralytic, and there is no excess tone of any one muscle. Sherrington's law doesn't apply here, right? Whereas paralytic squint usually is acquired, it has got diplopia. Whenever he looks towards the direction of that weak muscle, lot of times examiner's favorite question, he will give diplopia is worsening in particular direction, he will ask you is it left or right, superior or inferior, which oblique is involved. 100% you should be sure. Strabismus is one rewarding topic in ophthalmology, doctor, for MD entrance. Then similarly tropias versus 4 years, I leave all that literature for you. Alright, now let's go to the next question. Pterygium.
Astigmatism.
It leads to irregularity in the surface leading to astigmatism. Now cobblestone.
Vernal conjunctivitis.
What is your answer?
Vernal.
Vernal.
C, sir.
Vernal conjunctivitis. From tomorrow we will have evening 5 to 8 a quick review on forensic medicine. Those who are bored in the evening to study, please come down. 3 days we will review 600 questions, very high yield questions. If you don't get time from home, you can attend the online class free. Please do use it, because even we are restless at home without doing anything because notification came. So we too want to read along with you every day evening. What else? There is no other job that we can really enjoy doing. So please do come. On Saturday we have a pathology session. There is an excellent teacher, Dr. Rajeshwari in Chennai. Madam teaches as a star faculty in lot of coaching centers. She will give a wonderful rapid fire review on pathology on Saturday evening.
Time, sir.
Evening 5 to 8, any day. Any day is 5 to 8. On Wednesday we have a mock test once more. We are all going to meet up on Wednesday. Then next week we have Dr. Harita, who is one of the top dermatologists and excellent teacher, very passionate teacher from Guntur Medical College. Ma'am will be teaching dermatology. So if you feel bored that day in the evening, please come down to the center or at the home. So but don't say life is going slow. Now the life is expected to run at 300% faster. Cobblestone, where do you see that? Vernal. Now, ulcer serpents.
Murren's ulcer. C.
Typically in the case of the pneumococcus. Most serious injury is caused by Lyme any day. Lyme, generally by alkals. Most common intraocular tumor? Retinoblastoma. Then earliest vitamin A deficiency sign?
C. Xerosis.
C, sir.
Xerosis is much faster. Anybody thought Bitot spots? After a lot of xerosis, he has to develop it and come to you for you to discover it.
Symptoms, sir? Earliest symptom? Night blindness.
Inability to read MCQs in the night. Now, phacoemulsification. Ultrasound. Then dysphonia plica ventricularis. Favorite question of IBBG.
Ventricular fold. B.
Ventricular fold. Tracheostomy on which tracheal rings? Defining time in exam.
B. 2 to 4.
2 to 3.
2 to 4. B.
2 to 3. Then you must know high tracheostomy, what are the indications, etc., etc. Nasolacrimal duct.
B, sir. B.
Downward, backward, laterally. Then most frequent complication?
Bleeding.
Any surgery?
Bleeding.
So you have immediate, late complications, etc. Not a part of Valdeo's ring?
Thyroid.
I think cheapest question. Just to wake you up from sleep. Now diverticulum through Killian's is called?
Pharyngeal pouch.
Pharyngeal. Then
medialization. A, sir. Medialization.
Ishiki thyroplasty के बारे में you must be sure. A, you want to say medialization?
Yes, sir.
So is there any easy way, Ramakrishna, to remember what is medialization, lateralization? Some way you develop now, because in exam, so thyroplasty type 1 is medialization, type 2
lateralization,
used for spastic dysphonia, type 3 you will be pushing it back posteriorly and shorten the vocal cords, it is for the puberty dysphonia. And thyroplasty type 4, you will lengthen the vocal cords and increase the tension of the vocal folds. It is for the androphonia in females or a low pitched voice. Now doctor, Karat's notch?
C.
Then tympanogram, AS type?
A.
If nothing comes to your mind, odontology is the answer. High yield topic list. Top 20 topics. You will definitely have an ENT.
D.
Leforts?
A.
Middle 1/3 of the face. Then comes the gynops.
B.
So what is the deal in state MD entrance? 30 out of 30 whoever gets gynops, doctor. One of the parameters that will decide you will be in top 30 ranks. Simple rule. Every mark you lose in gynops is equal to 100 ranks behind. You know now calculation 25 I to 30 ko, you can expect 500 plus, because 5 ranks your every mark pushes you back. General medicine it is not like that. Every mark you lose in general medicine, 30-40 ranks you will be lagging behind. 30-40 ranks. Anatomy, all of us are equally foolish. You do mistake in anatomy, at most 3-4 ranks you will be lagging behind. So every subject has a lagging score. Be very sure. You are permitted to do 25 mistakes in exam. 25, you have that lifeline availability, but don't keep that lifeline in mind and start first to 25 wrong. It will be like Indian cricket for World Cup. No extra balls available. Every ball you have to hit a run means difficult. Now pelvic dimension, what is least?
Mid cavity.
Mid cavity you thought?
Ischial spines.
Plane of least dimension. Obstetrical outlet. It extends from the lower border of symphysis pubis to the tip of the ischial spines. It is called the plane of least pelvic dimension, or the narrow pelvic plane is what you need to remember.
Ischial spines will come under mid cavity, no sir. Plane of mid cavity.
Will come back. I think this is what my
Outlet
gyan
means,
goes.
outlet means intertuberous space is seen.
We'll come back on this. Okay. Since a lot of you are strong about mid cavity, we will check what is what our obstetrics classmates will say. And what is waist space of Morris, doctor? It should not exceed 1 centimeter. That is a very important rule. Largest skull diameter?
Mentovertical.
Mentovertical. Then this is another list, doctor. Which type of presentation, which type of diameter? 100% no confusion. Single most effective drug?
Methotrexate.
Methotrexate. That's good. Then carcinoma cervix? Squamous cell carcinoma. Premature contraction?
Isoxaprine.
Isoxaprine is tocolytic. Huh?
B also correct, sir.
B also correct.
B also correct.
Max sulfate was there, eh?
A and B.
Salmeterol.
A and B.
Agonist. B.
Salmeterol, which is a beta 2 agonistic agent, is also there. Okay. Now intrauterine death, you see?
B.
DIC. Then after 20 weeks,
A. Fetal urine.
it is the fetal urine. Then these values are also important. How many ml? How do you define oligo and polyhydramnios? Cord to margin.
Battledore.
Battledore.
Is Battledore.
It is Velamentus.
Oligohydrams except
Esophageal atresia.
esophageal atresia. Then contraindication for forceps.
Bro has no
There is no bro coming out
vagina.
just like that. Huh? So what are the conditions, prerequisites, contraindications? You must be quite sure for the vaginal delivery and forceps.
Missed abortion.
Huh?
Missed abortion. Missed
abortion.
Missed abortion.
Missed abortion. As for missed, threatened, threatening, everything you must be sure. Okay. Then most common cause of PID?
IUCD.
D.
IUCD, sir.
It's my mistake to give this question. Different books differ differently.
TB was.
Sir, IUCD, sir.
Sir, it should be either T or STD. Yeah, sorry, TB or STD.
No, there is always, it's a debatable question. So maybe what is the most recent given in the Shaw, we will go by that. I didn't have a reference, just check that. Huh? Now once more, according to age also it differs. Then fractional curettage, where will you do?
Endometrium.
Then most common symptom of endometriosis? Dysmenorrhea. Fallopian tube pregnancy?
A.
You can't do this hysteroscopy. Sling operation except?
Lefort.
Lefort is done in elderly female where you are virtually closing the opening. Now monoamnionic, monochorionic.
1 to 3 days.
B. After 8 days.
This question you can't do second. Wrong means 500 ranks behind. Below.
D.
After 8 days. Anybody said 1 to 2 days? Ramakrishna? I heard from you. No. Okay. After 8 days. Doctor, diamnionic, monochorionic at 4 to 8 days. Diamnionic, dichorionic within 3 days. Monoamnionic, monochorionic after 8 days is what you need to be quite sure. In Visakha Krishna, capital is written for
14 days.
14 days.
2 weeks. 2 weeks. Very standard questions. Then all are complication of IUCD.
Malignancy.
It won't lead to any malignancy. Mala N has
A.
ethinyl estradiol. Highest failure rate?
Condom.
Condom.
Condom. Then most common manifestation?
Pain abdomen.
Pain abdomen. Once more here there is an important issue. Amenorrhea followed by abdominal pain and lastly vaginal bleeding. That's the typical order. Is the classic triad. Abdominal pain, but is the most constant feature of this triad, is what you need to be emphatically sure about. Between cyto and maternal blood, which will not come?
A.
Decidua peritonealis doesn't come. It is situated away from the attachment of embryo. Inversion of the uterus is not due to?
Control contraction. A.
Controlled contraction. Brandt Andrews method of delivering the placenta. So doctor, let us check quickly last week toppers. Chisel your hand. Last week I think somebody might have crossed that 150 benchmark is what we are thinking. This week onwards we are also having Bangalore and Chennai, we opened a test center. So a lot of our AP students, as such there are no teachers in AP, they go to Chennai and Bangalore. Yeah, they are also writing the exam. So next week we will have very good, excellent. Please give one loud clap, doctor. Vijaya from Secunderabad makes us once more proud with 151, crossing that benchmark called 150. Nafis, copy kiya aapne? Are you sure? Oh, come on, give another big clap. 148 makes us once more feel proud. Anirudh from Vizag gets 146. Please give a loud clap. And from our Amirpet Center, Srijana with 145. Santosh Reddy, he is here with 145. And from Secunderabad, Harika, please give a big clap with 143. So that makes the crowd really great. Now, doctor, this is the last week. So let's go back to the last 3-4 questions. You can tell your classmates within another 1 to 2 hours we will upload this video into YouTube. So those who missed this discussion can participate, can listen it on YouTube. So what is not true about subtly? Actually, this is a wrong frame. We should say what is true about subtly cell tumor. Then what is your answer? Subtly is virilizing tumor, basically. Then what is your answer? Suppose if not is removed, then becomes B, 3rd or 4th decade, younger age group. It arises from the hilum, androgen producing, usually unilateral in nature. Which you don't do? Hepatitis A you don't do. Then HSV2 causes?
Genital herpes.
Genital herpes, that's right. Then antidote?
Calcium gluconate.
Calcium gluconate. Next week we will give some tough gynops questions. Adenomyosis is?
Interna.
Interna, that's good. Snowstorm is?
Mole.
Height form mole. So thanks for your patient listening, doctor. Please come for tomorrow's forensic class. Let's have some quick review. Thank you.